Hi, everyone. My name is Sandra Arevalo, and I'm the Director of Community Health and Wellness at Montefiore Nyack Hospital here in Nyack, New York. And we do this program called Community Chats. Our goal is to bring education about health, resources, community events to our community. So if you're from Rockland or not, or maybe you're from Westchester or the Bronx, or maybe even further away, this information is useful for everybody. So welcome. And today we're going to be talking about epilepsy. And we have an expert, as every Thursday at noon, with us today. And Michelle, thank you so much for being here. Michelle Quinn is our expert of the day. And Michelle, tell us a little bit about you and your organization. How did you get involved with this epilepsy work?
Oh, sure. Thank you, Sandra, and thank you so much for having me. My name is Michelle Quinn. I'm the Community Education Specialist at Capabilities Partnership. We are a not-for-profit that services the Lower Hudson Valley area. We work with individuals, with everything from uh, epilepsy to other neurological conditions to traumatic brain injuries. And we help them find services and help them function as independently in the community as possible. I personally got involved because I'm a former teacher. I had to stay home. My younger daughter has autism and was having seizures. And I was looking, to navigate this whole new world and looking for information. And I kind of fell into this position. It just was serendipitous, and I learned so much, and I wanted to help other families.
Yeah, well, thank you so much. I'm sorry to hear about your daughter, but I hope she's well now.
Yeah, she's doing better.
Oh,
Thank
that's
you.
great.
Yeah.
Okay,
Yeah.
great to hear. And I always say this that you don't know, or as people say, right? If they send you lemons, you definitely made lemonade out of that. So congratulations for that and
Thank
all
you.
the best. Whenever you're ready, I know that you have a PowerPoint for us, so
Sure.
you are able to share your screen.
Mhm. Okay, I'll get started then. I have a presentation and then I have some videos that will kind of show what a seizure can look like, a grand mal. And sometimes a picture helps, so we'll go through what epilepsy is, the different types of seizures, seizure first aid, and then, we'll have time for a discussion as well. So,
And to our participants, don't forget that this information is really for you and thinking of you. So use the Q&A, use the chat, start sending your comments, your questions. As soon as Michelle ends her presentation, I'm going to be able to read all the comments and questions. And, we want to really interact with you. So please take advantage of this opportunity. And now, Michelle, I can see your screen. I don't know if you want to make it a little bigger, like in presentation mode. And I'm out of here just letting you run the show.
okay. So I'm just going to move forward. So this is information about capabilities. And what is epilepsy? So epilepsy is a neurological condition that produces brief, intense disturbances in the normal electrical functions of the brain. And these unusual bursts of energy are called seizures. And that's why epilepsy is referred to as seizure disorder. You have to have more than one seizure for it to be diagnosed as epilepsy. And a seizure is a brief excessive discharge of electrical activity in the brain that alters one or more of the following. It can alter your movement, which is, our muscles, sensation, our behavior, and our general awareness. And it's very, very prevalent. So over 3 million Americans are living with epilepsy, and approximately 200,000 new cases of epilepsy are diagnosed each year. 1 in 10 adults will experience a seizure in their lifetime, and 3% of the population will develop epilepsy by age 75. So we're always looking for like what causes epilepsy. And in about 7 out of 10 people, we're not sure. They've done testing, they may have done EEGs or genetic testing, and the results were not conclusive. So, again, just remember that, sometimes there are seizures outside of epilepsy. In the case of, say, a head trauma, there may be one standalone seizure, but for it to be diagnosed as epilepsy, it has to be more than one. So some of the known causes of seizures are genetic. The individual is born with it. They may have a relative who also has epilepsy, a birth injury, such as a lack of oxygen to the brain during the birthing process. It can also lead to other types of movement disorders. An infection like encephalitis or meningitis, where there's inflammation and swelling in the brain that can cause damage to tissue. A developmental disability such as autism or Rett, like in my family's case, my daughter has autism, but she also had seizure disorder. And, they say there's about a 30 to 40% chance of an individual with autism also having seizure disorder. Trauma to the brain, there's a main cause of seizures. It could be anything from a concussion or a major head trauma during a car accident. It could be even an internal trauma, such as, say, a stroke or a tumor. Even the removal of the tumor or the treatment of the tumor can cause scar tissue or can cause damage to tissue during treatment, and this can lead to seizures. Tumors, stroke, the lack of blood to a certain area of the brain can damage that tissue, resulting in electrical imbalances, and then drugs and alcohol. This is everything from, things that may be contraindicated to, abuse of certain, even prescription drugs that are not taken properly. So it's really important that we always check with our doctors before taking anything new, even supplements. There's two main types of seizures, generalized and partial. And generalized affects nerve cells throughout the entire brain. It involves a total loss of consciousness, and it's the best known type of seizure. It's kind of what we see or what we think about when we think about a seizure, where the person, convulses and then, falls down. That's the grand mal type of seizure. And then partial is affecting nerve cells in only one area of the brain, and there may be partial or no loss of consciousness. This is the most common type of seizure. It's also sometimes very difficult to diagnose. And, if we look at this diagram, you see focal is the same, type of, it's another term for partial. You see it's occurring in one specific area of the brain, and it may specifically, impact that, specific skill. It may impair your language or your hearing or movement on one side of your body. Generalized, the whole brain is affected, and the person usually will, lose consciousness and have convulsions. And then unknown onset means we're not sure where the seizure is originating, and that's more difficult to treat. And sometimes they may not be able to manage their seizures with medication. They may have to look to alternative treatments, which we can discuss after. Generalized seizure are broken down into tonic-clonic, absent, atonic, and myoclonic. And tonic-clonic are the grand mal seizures. They're the best known type of seizure. It begins with the body stiffening, that's the tonic phase, followed by jerking movements of the entire body and convulsions. That's the clonic phase. It lasts for 1 to 2 minutes, and it's followed by sleepiness or confusion, and there's usually a total loss of consciousness. And this can be, quite scary and frightening if you're seeing it for the first time. And that's why the education is so important to know how to treat it. And how do we treat a tonic-clonic seizure? So first thing we'll do is check for a medic alert or an ID bracelet, stating they have seizure disorder, and you will time the seizure. And this information is important because it's passed on to the individual's doctor and recorded in their action plan so that we know, for next time, and we have the information to help treat them better. If they fall, we will protect the head. You'll put a sweater or a scarf or anything under the person's head so that in case they're convulsing, they're not creating further damage to their head. You'll gently turn the person to one side with their head facing down to prevent choking. This way, if they do, vomit, they will, they won't block their airway. You'll remove glasses or loosen any tight neckwear so their breathing is not constricted. You'll move harder, sharp objects out of the way so they can't injure themselves any further, and you'll just make sure the environment is generally safe. Absent are known as petite mal seizures, and these are very, very common in children and can be misdiagnosed as ADHD or just, daydreaming. It's a blank stare that lasts only a few seconds with a complete loss of awareness. And there are no warning and no after effects. Usually the person will just kind of looks like they're snapping out of it and they'll immediately resume activity. Um, they can be very difficult to detect. Some children may be having 50 to 100 a day. And you can imagine the impact it would have on a child's learning if they're kind of going in and out and not able to maintain focus for the entire lesson. So first aid is usually there's no first aid needed. They're very brief, 20 seconds to 2 minutes, and the person, can't snap out of it. They will not be able to respond. The person can remain sitting if they're comfortable. And if the person is sleepy or confused, you're going to help reorient them to the surroundings. Atonic are known as drop attacks, and this is a sudden collapse due to a loss of muscle tone. There's usually a really rapid recovery. It can look like fainting, so it could be misdiagnosed as, something else in that sense. Unfortunately, it can result in head injuries if they fall and hurt and bang their head. So sometimes individuals with this type of seizure will wear a protective helmet just in case. And no first aid is needed unless they've injured themselves from the fall. Myoclonic are rapid, brief contractions involving all or part of the body. It usually occurs on one side of the body. It may be mistaken for clumsiness. They may, walk into a door or trip, and so that could be difficult to diagnose. First aid is usually not needed unless they've, injured themselves. So now to partial seizures. So these will be broken down to simple partial and complex partial. And the simple partial is limited to one specific area on one side of the brain. The person remains fully conscious and it may affect the senses. So a person may complain all of a sudden of having a very strong emotion. They may be overwhelmed with a sense of anxiety or sadness or rage. They may smell something strange or hear like a ringing sound, or they may even see things that are not there. And these kind of little warnings are auras, and they may precede the full-blown seizure or may just stop there. They're very brief, and usually no first aid is needed. Complex partial is the most common type of seizure, and sometimes a simple partial will develop into a complex partial. Consciousness is impaired or lost, and the person's unaware of the environment. They may experience auras or wander. They may just, start walking around aimlessly and look like sleepwalking. They may display automatisms, repetitive movements such as, hand wringing or chewing or picking at buttons, and there may be mild to moderate confusion and sleepiness afterwards. And this can be difficult to diagnose as well because, in an individual with autism, it may look like a stimming behavior, like a self-soothing behavior, whereas they're actually having seizure activity. So first aid for complex partial is allow the person to remain seated if comfortable. Do not restrain, do not hold down. Gently direct away from environmental hazards. Verbal instructions will not be heard or understood, and then afterwards will help reorient them to surroundings. Status epilepticus is a continuous state of seizure. Very, very scary, very dangerous. There's an increased risk of status epilepticus if seizures are prolonged or occur in a series. It's when the seizure does not end, within, a couple seconds or a couple minutes. It just keeps going and doesn't stop, or it's like, one seizure followed by another seizure, followed by another seizure. It's considered a medical emergency, and it usually occurs in people who have an acute illness or a brain tumor. And sometimes the individuals will be, put into a medical coma, a medicated coma, and just to protect the brain until they can find something to, medicate or moderate the seizures. So when do we call EMS? We call if it's the first time seizure ever. If it lasts more than 5 minutes or another seizure immediately follows the first. If the person is injured or if they're pregnant or if they have another medical condition, say, such as diabetes. Um, if they do not resume normal breathing, you start CPR, or if it occurs in water, a shower, a pool, bath, they may have ingested water and it could impact their breathing. So we call EMS right away. Every, you know, every agency or school may have a different timeline. So most schools will have you call 911 immediately. Whereas say a day hab program may have you wait and see if it lasts more than 5 minutes because, this may be their norm. They may have, petite mal seizures that last for a couple seconds or a couple minutes, and we do not need to call 911 in that case if they have not injured themselves and they're safe. So we always stay with the person or arrange for someone to stay until they're fully awake and oriented. We provide the person with emotional support and reassurance, and we help other people understand by explaining what's happening. Not right then and there, because the person's in a very vulnerable state, and we want to respect their feelings and their privacy. But afterwards, you would have a discussion with the individuals or whoever is, around this individual to help them understand and understand what to do next time in case it happens again. So here are some of the myths that we will debunk. We never ever put anything in a person's mouth. It's very dangerous. You could hurt them more. They may choke. They may, have damage to their teeth or their tongue. The biggest thing is that we do not want them choking. And you may be, if you put like fingers inside their mouth because you're afraid they're going to swallow their tongue, you may be bitten and you could get hurt. So years ago there was a wives' tale. An old wives' tale put a spoon in their mouth because they may swallow their tongue. That's not possible. Just put them on their side with their head facing forward so the tongue falls forward, and do not put anything in their mouth. Do not offer food or drink until the person's fully recovered. The same with any oral anti-seizure medications. And do not hold down or restrain the person. You may get injured because their muscles are, in the tonic-clonic phase. They may injure you, and we're trying to keep everybody as safe as possible, so that the seizure can just pass as quickly and safely as possible. So we need to remember that, the calmer we are, the better it will be, even though it is very difficult to stay calm in these kind of situations sometimes. But, we stay calm. We understand that most likely the seizure will not last long. It will be a couple seconds to a couple minutes. It will end naturally, just the way it started. The person will just stop and they may be sleepy. They may need to go to the bathroom. It's a very vulnerable time after a seizure for an individual. And you can't stop it. It's not something they have control of. And it's not dangerous to others unless you make it so. There's still some myths out there about seizures that it's something that can be caught, like a cold. It's contagious. And that's not true. It's completely biological, neurological. So it's not something you're going to catch from somebody. It has nothing to do with somebody's mental health. It's not a mental illness. Another myth that we're trying to, debunk. Some seizure triggers, missing medications, big one. Stress and anxiety, a lack of sleep or extreme fatigue, hormonal changes during adolescence or pregnancy. Photosensitivity, sometimes you'll see at movies or, when people are playing video games, it may say, sensitive light stimulation, which could cause a seizure for some individuals. Sensory stimuli like light touch or immersion in water. Drug interactions, taking things, medications or supplements or even certain foods that can lower the potency of your medications. So before you make any dietary changes, it's always good to check with your neurologist as well. Abuse and withdrawal from alcohol or drugs, not checking with your neurologist to titrate off drugs slowly. Just going cold turkey is not a safe thing to do because it can result in a seizure. This is a seizure action plan, and this is a document that is updated frequently, if necessary. But usually it's developed with the individual, if possible, their neurologist, their family, their entire staff, like their team, a teacher or a aide or their day hab staff, nursing, and it details all their important information, their profile information. It will say the type of medication they have, the dosage, the frequency. It will detail the type of seizures they have, the frequency, the length of the seizure, and it will also tell you what to do for them after a seizure. So, they may lose bowel control or bladder control, and they may need a change of clothes. They may need to lie down in a dark room. They may need to go home. May need to call somebody. And this is a good tool because it helps everyone be on the same page and it helps everyone know exactly what this person's seizures look like. And it also lets you know if if they're having another seizure and it doesn't look like what's on their plan. That's really important to document because then oh, this is different. We need to call 911. This needs to be updated, and such helpful information then to bring back to their neurologist. It will help direct their best treatment and their best care. This is my information, and my email is right here. So there will be an evaluation that will be emailed out to you afterwards, and you can email it back to me at mquinn@cpiny.org. You can also email me with any questions. I'll get back to you. If you want another training or an agency that would like a training, these trainings are all free to the community. I can do it Zoom or in person. And now I'm going to stop this and show some videos.
Well,
do you want me to do questions first?
well, we don't have any questions right now, but I was just gonna say thank you for the information. I never knew, that there were like different types of seizures or epilepsy or things like that. You just hear about one, I guess.
Yeah. You see the one on TV and you think, oh, that's what they all look like, but it's a spectrum, just like a lot of other things.
Exactly. So that's very interesting to me,
Yeah.
and it's good that we're putting that information out to the community because we might see somebody going through something and we might not know what it is, but now we do, thanks to you. So thank you.
And thanks to you for having us here. I appreciate that. Okay, so I'm going to show a video of what, it looks like in the brain, the seizure, and then how to treat somebody who's having a grand mal seizure.
Okay.
So I'll share that now. Okay. Hope you can hear.
Your brain contains billions of nerve cells, called neurons, that communicate with each other by sending and receiving electrical impulses. A seizure occurs when there is sudden abnormal electrical activity that temporarily interrupts normal brain function. Large groups of neurons fire at the same time, like an electrical storm inside the brain that usually lasts from 30 seconds to 2 minutes. This extra activity can cause changes in behavior, sensation, movements, or awareness. There are 2 types of seizures. Focal, or partial seizures, happen in just one part of the brain, while generalized seizures seem to occur all over the brain. Symptoms usually vary depending on the type of seizure and can include temporary confusion, staring spells, convulsions, or loss of consciousness. If you think you've had a seizure, talk to your doctor right away for more information.
This will show you what to do how people would be, should be treated if they're having a grand mal seizure.
Guys, give us some room. He's having a seizure.
Get me some towels.
Okay. Stay calm. It's going to be fine. Help me get him on his side. All right, listen up, fellas. Before we practice, I want to go over a couple of things. First, I'd like to welcome back Michael. Huh? Good to have you back. We all know Michael has epilepsy, and he shared his seizure with us in the game. He has something he wants to say.
Yeah, thank you all for supporting me, and thanks to Coach for knowing what to do. I'm sorry if my seizure scared you guys. It could be scary for me too. But what's even more scary is if people didn't know what to do.
So today, we are going to learn seizure first aid thanks to the Epilepsy Foundation. We're teammates, right? We take care of one another, we count on one another, and when anyone with epilepsy has a seizure in front of you, they're your teammate. And they're counting on you. So, first, stay with him. Okay, stay calm and keep others around you calm and out of the way. Protect him, keep him safe. It's also important to remember that the person having the seizure should be lying down and that there is nothing harmful in their way. Turn them on their side and support their head so that they're not banging it and so they don't choke. Never put anything in their mouths and do not hold them down. Time the seizure till the very end. Okay? Knowing how long the seizure lasts is important information for the doctors to know. If the seizure lasts more than 5 minutes, call 911. When you see somebody having a seizure, you're going to feel a little powerless. But if you protect them and if you stick with them by their side, you're doing the right thing. Okay? All right, let's practice this.
Bulldogs on 3. 1, 2, 3.
Bulldogs! Go! Yeah.
Wow. I have to say, this is the total opposite I always heard about epilepsy. I always heard you see somebody put a towel in their mouth, they're gonna bite their tongue, they're gonna swallow their tongue, don't give them anything because they're gonna choke and die. I mean, this looks so calm. And I'm like, oh my God, nobody's doing anything. And then they explain it.
Yeah. Yeah. That's it. It's a little bit like make them be as safe as possible, and then it's hands off, and let the seizure just, run its course. As long as they're, safe, it usually is just, going to end naturally. And if you put something in their mouth, you're going to be endangering them more because it's not safe to put anything in their mouth. So that's the big takeaway is do not put anything in their mouth, do not hold them down. And just stay as calm as possible because it is scary and you do feel powerless.
Yeah. There is only something that I have to ask you. In the video, he says time, how long the seizure lasts. If it's over 5 minutes, call 911.
Right.
Does that mean that if it's less than 5 minutes, you're good to okay, stand up and go and continue doing what you're doing? Or should you always call 911?
Yeah, I mean, it's dependent on some things, so for sure, if it's their first time seizure or if it's your school or agency protocol, so a lot of the schools I'll go into, they just automatically call 911, and also their seizure action plan, that's why it's important, it depends on what, their plan says too, what they need. So I think, 5 minutes is the rule. But it's also like, dependent on different conditions for sure. But like if you take different types of seizures, say a petite mal seizure where the person's just staring out the window, you know, and they're not endangered and they're not hurt or injured, we don't need to call 911 in that case, unless you see the person's not really responding for 5 minutes, So, it's going to be dependent on the type of seizure, the person's environment, whether it's their first time seizure, what their plan is. So it's.
Also, for example, in this video, it's like the kid fell real
Yeah.
hard against the
Yeah.
floor.
Right.
So
Right.
shouldn't you just go and watch
Yeah,
it
I mean,
because of the
you would
fall?
look, yeah, you'd say, he may have had a head injury, right? So
Exactly.
you can't go wrong erring on the side of caution, right? It's better to be safe than sorry. So in that case, I would, probably recommend
I mean,
let's
because
get you checked out, make sure there's nothing else, happening. You didn't get a concussion that we need to, treat. So yeah.
well, to me, the most important message here, again,
Yeah.
this is just for me,
hmm
remain calm.
Yeah, which is the hardest thing, right? But education is power, and the more you know, you don't know what you don't know. So, the more you know, the more empowered you feel, and then the more in control you can be, because it
Yeah.
doesn't help anybody when we panic, right?
Exactly. So yeah, I think remain calm. I remember one time but I've seen it a couple of times. And yeah, you never know what to do. So this is good. It's like, okay, remain calm, make sure everything,
Right, having a
the
plan
wallet
is number
stays in the
one.
pocket.
Yeah. Right,
And
and things
that's
don't
it.
always go according to plan, but you have a set of rules and guidelines to guide you so that you can hopefully keep the individual safe and yourself safe, and that's the most important thing.
Yeah. Well, thank you so much,
Oh,
Michelle, for
thank
this.
you.
I definitely learned a lot, and I'm sure that our
Good.
attendees have learned too, and many people who are watching the recording.
Sure.
So now we feel better prepared if something like this crosses our paths. Then that's all thanks to you, Michelle.
You're welcome. And you can also get more information by going to our website, www.learnaboutepilepsy.com. It's our capabilities website, and there's lots of information and resources and, stuff that can help anyone living with epilepsy or taking care of somebody with epilepsy.
Yeah. Well, thank you again, and we'll see you soon.
Okay. Thank you for
And thank
having
you
me.
to of course, and thank you to our participants. And again, don't forget to share this information with other people, because as Michelle said, the more information we have, the better. So next week, we're going to be talking about, that's an interesting one too. Well, to me, everything's interesting. So it's about menopause. It says breaking the silence about menopause. So we're going to be talking about all the changes and everything that happens that sometimes we don't feel very comfortable talking about, but definitely needs to be talked about. So I will see you next week for that. And thank you, Michelle, again.
Thank you. Take care.
Bye-bye, everyone.
Bye.